patient arrives in the emergency room with fever, weakness, and confusion. At first glance, it looks like another routine admission, but within minutes, small details begin to suggest that something far more serious may be happening. Welcome to the Learning Studio, where we don't just teach theory, we show how knowledge turns into real-world understanding. Sepsis is often misunderstood as a sudden event, but in reality, it develops quietly. Many patients do not arrive critically ill. They deteriorate because early warning signs are missed or underestimated. This case study focuses on how nurses recognize sepsis early and act before irreversible damage occurs. Imagine a 65-year-old patient brought in by family members. He has a history of diabetes and a recent urinary tract infection. His temperature is slightly elevated. His heart rate is faster than normal. His respiratory rate is higher than expected. His blood pressure is borderline low. None of these values alone look dramatic, but together they tell a different story. At the bedside, the nurse begins assessment. The patient appears confused and unusually lethargic. Skin feels warm. Urine output has been low. These findings raise concern because they suggest infection is affecting the entire body, not just one organ. This is the moment where nursing judgment matters most. Sepsis occurs when the body's response to infection becomes uncontrolled, leading to inflammation, poor tissue perfusion, and organ dysfunction. Nurses do not need to diagnose sepsis, but they must recognize when the body is failing to cope with infection. Early recognition is often the difference between recovery and rapid decline. The nurse prioritizes assessment using the ABC framework. The airway is clear. Breathing is rapid but present. Circulation is concerning due to tachycardia and falling blood pressure. Oxygen is applied, vital signs are reassessed, and the healthcare team is notified immediately. Delaying action at this stage can be fatal. As interventions begin, IV access is established, blood cultures are prepared, and fluids are started as ordered. The nurse closely monitors response to treatment, watching for changes in blood pressure, mental status, urine output, and oxygen saturation. Every minute matters. This case highlights a critical nursing responsibility. Sepsis protocols often begin with nursing assessment. Nurses are the first to notice subtle changes and the first to escalate care. Waiting for laboratory confirmation delays life-saving treatment. The nclex frequently tests scenarios like this, not by naming sepsis directly, but by describing patterns. Elevated temperature, increased heart rate, rapid breathing, confusion, and low blood pressure together signal danger. The correct answer is usually the action that supports circulation, oxygenation, and rapid intervention. In real clinical practice, sepsis management depends on teamwork, but nurses drive early detection. Their ability to connect vital signs, patient history, and subtle changes protects patients long before the situation becomes obvious. Now that you have seen how sepsis presents in a real emergency setting and how nursing actions shape outcomes, the next step is learning how vital sign trends and assessment tools help nurses detect deterioration even earlier. That deeper pattern recognition is where clinical confidence truly develops, and that's exactly where we'll go next here at the Learning Studio.